A ketogenic diet can be a powerful tool for reversing chronic diseases. Many people suffer from conditions like type 2 diabetes, hypertension, and fatty liver disease. These conditions are often seen as irreversible. However, a ketogenic diet offers a different approach. Studies show that this diet can reverse these conditions in a matter of weeks. The success rate of ketogenic diets is remarkable. Standard care for type 2 diabetes has a reversal rate of only 0.1%. In contrast, ketogenic diets have shown a reversal rate of over 50%. This means that people with type 2 diabetes have a much higher chance of reversing their condition by adopting a ketogenic lifestyle. This success is not limited to type 2 diabetes. Hypertension, also known as high blood pressure, can also be significantly improved. The ketogenic diet helps regulate blood pressure and reduce the risk of cardiovascular events. Similarly, non-alcoholic fatty liver disease, a condition in which fat builds up in the liver, can be effectively addressed through a ketogenic diet. Despite the evidence, the media rarely reports on the power of ketogenic diets. This lack of coverage raises questions about the influence of pharmaceutical companies. These companies have a vested interest in maintaining the status quo, where drugs are the primary treatment for chronic diseases. The medical community also shows resistance to dietary interventions. Since the 1970s, there has been skepticism towards low-carbohydrate diets. This skepticism is partly due to the influence of organizations like the American Heart Association, which have received funding from food and pharmaceutical companies. This resistance has real-world consequences. Medical education primarily focuses on pharmaceutical treatments, neglecting the importance of dietary interventions. As a result, many healthcare professionals are not equipped to advise their patients on the benefits of a ketogenic diet. The largest study on disease reversal involved 300 patients. Half of the participants were able to reverse their diabetes diagnosis. Nearly all participants reduced their medication intake within a year. These findings highlight the potential of dietary interventions. A ketogenic diet involves drastically reducing carbohydrate intake and replacing it with healthy fats. This forces the body into a metabolic state called ketosis. In ketosis, the body starts burning fat for fuel instead of glucose from carbohydrates. The ideal foods for a ketogenic diet include healthy fats like avocado, olive oil, nuts and seeds, protein sources such as meat, poultry, fish and eggs, and non-starchy vegetables like spinach, broccoli and cauliflower. Sugar and processed foods are strictly limited. These foods spike blood sugar levels and disrupt the metabolic balance needed for ketosis. The focus is on whole, unprocessed foods that provide the body with essential nutrients. One reason ketogenic diets are effective is their impact on hunger hormones. Protein and fat are more satiating than carbohydrates. This means that people on a ketogenic diet feel fuller for longer, reducing cravings and overeating. While the evidence for ketogenic diets is compelling, more research is needed. Long-term studies are crucial to fully understand the benefits and potential risks. Randomized controlled trials can provide more robust evidence to support the use of ketogenic diets in clinical settings. Medical education needs to prioritize dietary interventions alongside pharmaceutical treatments. Healthcare professionals should receive comprehensive training on the impact of nutrition on chronic diseases. This will empower them to provide patients with well-rounded advice and support. Federal dietary guidelines also need to be re-evaluated. The current guidelines, heavily influenced by the food and pharmaceutical industries, have contributed to the rise of chronic diseases. A shift towards guidelines that prioritize whole, unprocessed foods is essential for improving public health. The potential of ketogenic diets to reverse chronic diseases is undeniable. By addressing the resistance from the media, medical community, and rethinking federal guidelines, we can unlock the power of nutrition and pave the way for a healthier future.